Good morning, and thank you for coming. My name is Twyla Braze. I am president and co-founder of the Citizens Council for Health Freedom. And our mission is to protect healthcare choices, individualized patient care, and medical and genetic privacy. Today, we are launching the Wedge of Health Freedom for the purpose of putting patients and doctors back together again and setting both patients and doctors free. Follow along with the 6 slides in your packet, starting with slide number 2. Today's healthcare system is filled with a maze of costly, intrusive, and restrictive corporate and regulatory controls over the practice of medicine and the delivery of healthcare services. Patients and doctors are both experiencing delays and denials. In short, the mission of medicine, taking care of patients, is being lost to the business of healthcare. We are introducing the Wedge of Health Freedom to bring patients and doctors back together again in a trusted, ethical, caring relationship that's affordable. Slide number 3. The Wedge of Health Freedom is a free trade zone for healthcare. Now, the zone exists today. There are pockets of patients and doctors everywhere around the country who are working together, interacting freely. So it's not new, but for the most part and for most Americans, it's invisible. So our goal with this initiative is to make the invisible visible, to point out its benefits to patients and doctors everywhere, to grow it as patients and doctors escape into the Wedge of Health Freedom, and to protect it for the future of freedom. We are branding the free trade zone as the Wedge of Health Freedom to capture the attention of the American public. We are going to use it to point the way to the freedom of third-party free practices that are patient-friendly, pocketbook and price-friendly, and privacy-friendly. This is how healthcare should be, this is how healthcare used to be, and this is how healthcare must be in the future. The Wedge is not only a zone of freedom within the healthcare circle. The Wedge is also the name for our organization. The Wedge is also the name of a new movement, a movement to grow and protect health freedom in this country so that it cannot be taken away from patients and doctors ever. In the Wedge, patients and doctors escape corporate and government controls. In the Wedge, the patient's only contract is with the patient. In the Wedge, the doctor's only contract is with the patient. In the Wedge, costs are lower because the practices are free of third-party requirements. In the Wedge, patients pay by cash, check, or charge. And more patients today than ever are looking for affordable options because they have high deductibles, because they have high premiums, and because many of them are choosing cash-based health-sharing organizations. The Wedge has 8 principles for Wedge practices. They are transparent, affordable pricing, freedom to choose, true patient privacy, no government reporting, no outside interference, cash-based pricing, protected patient-doctor relationship, and all patients are welcome. All means both the uninsured and the insured, the covered and the uncovered are all welcome. Slide number 6. The Wedge of Health Freedom takes us back to the future in healthcare. It takes us back to direct patient-doctor relationships free of intrusions and regulatory restrictions. Here to show you how this works, how the Wedge works, are 2 physicians operating in the free trade zone with Wedge-like practices. The first is Dr. Alida Eck. Dr. Eck is a specialist in internal medicine in private practice with her husband, John Eck, in New Jersey. They are not enrolled in any healthcare plan, and their patients pay them directly. When her patients need to be hospitalized, she will admit them and see them every day. 13 years ago, the Drs. Eck started a non-government free clinic where they see the poor, uninsured patients and the Medicare patients who cannot find a doctor. Dr. Eck will explain how she supports the Wedge of Health Freedom and why it's important for the patient and the doctor to be free. Dr. Eck.
Thank you, Twyla. I'm a physician in private practice, and I'm here to tell you why patients do better when they see the same physician for many years, and that doctor knows them, is available 24/7, and will even admit them to the hospital if the need arises. When my husband and I started our practice, we joined one HMO early on, but we found out that the insurance company was always suspicious of our motives and would try to figure out ways to not pay us. And they made us report more and more. They and the government were like an elephant sitting on our laps, which were heavy and painful, and it was hard to see our patients because there was something in between us. We dropped that contract a few years later and chose to work directly with our patients. So our patients pay us a fair fee, and whatever we get back from insurance is not our business. Whatever they get back is not our business. Our business is to take care of the patient and do the best we can for them. The best patient is a happy patient who listens to us, who values our opinions, and does what we say, and is willing to pay for our services. And if they need a specialist, I choose one that I would trust. Patients have stayed with us through the years. Their employers have changed plans, and the plans always want them to go to a doctor in their plan, which is not me. But our patients have said, no, I don't think so. I'm not going to leave Dr. Eck. So they stay with us because they know I work for them. I don't work for a hospital, I don't work for an insurance company, and I don't work for the government. Our medical records stay within our practice. We don't share them with anyone unless the patient wants us to communicate with another doctor who they need to see. And we'll also give the records to the patients. To demonstrate what a caring doctor, the difference a caring doctor can make to a hurting patient, I want to tell you a story. 13 years ago, we started a non-government free clinic, and there we see patients who have no money, have no insurance, and often they're on Medicaid, but they can't find a doctor. Last August, a woman came in. She had been severely injured in a grease fire where she got a burn over the side of her face and her chest. The burn unit hospital saved her life, and we're grateful for that. It gave her initial skin grafts. But once she was discharged and she was on Medicaid, they said you have to find a doctor who will take care of you, and she couldn't. Nobody would see her. She'd go back to the burn hospital, and they said, oh, you got to go to a hospital in your county. She would go to the county hospital and said, you got to go back to the burn hospital. And she was developing contractures from these scars that were contracting, and her neck was becoming, moving to the side. She was in great pain. So she came to our clinic. And we just stood there and listened to this story and just were horrified at how this could happen to a human being in the United States. Anyway, together I met with a plastic surgeon I know who connected me with a plastic surgeon in the university who then wrote me a nicest letter saying, we'll take care of this patient. He actually saw her and he developed a plan. He's going to take care of her. He's going to restore her to good health. I learned that doctors working with doctors can cut through all of that red tape. And isn't that really what we want? At the end of the day, isn't that what every patient wants? They want a doctor who's dedicated to helping her. That's the mission of medicine that's being lost every day as health plan restrictions, government regulations, reporting requirements sap physicians of the time, energy, and finances that they need to fully engage with their patients. I've lived and embraced the concept of the wedge of health freedom. I don't have to rush through 30 patients a day in order to earn a living, as we've eliminated the middleman. And I love what I do. I'm able to instill hope in the next crop of doctors as medical students come through our clinic and they see what we do and they come to our office. They get it. And I look forward to watching many of my colleagues and the new medical student graduates become wedge practices. Thank you.
Thank you, Dr. Eck. Now we are going to hear from Dr. Brenda Arnett, who is a physician practicing. She has a third-party free clinic in Virginia, and she will tell us why she chose to go that direction. Thank you, Dr. Arnett.
Thank you, Twyla, for asking me to speak. I'm glad to be here for the launch of the Wedge of Health Freedom and be able to tell you about my particular type of medical practice. I am an internal medicine physician from Winchester, Virginia, where over the past 10 years I have developed a successful, private, cash-based, third-party free medical practice. My patients love the care they receive, and I am a much happier physician. I'm actually a third-generation physician, and both my father and my grandfather were instrumental in getting me interested in medicine, as well as guiding me away from today's traditional mainstream medicine. My grandfather practiced medicine in rural West Virginia in the 1940s and 50s, before there was an infiltration of government and third parties in medicine. He actually charged $5 for an office visit. If the patient couldn't pay, he would accept produce or something that he or his family needed. He also gave charity care to the poorest members of the community. Healthcare was affordable and accessible at that time. My father, who's here, practiced medicine before Medicare and post-Medicare invasion, as I like to call it, and he remembers when Medicare auditors began showing up in hospitals. He was alarmed at the decisions being made by an entity that didn't know the patient and also had little medical training. During my residency and the 1 year I spent in a traditional multi-specialty group practice, I became extremely frustrated with the large number of patients that I had to see per day. Frustrated with the insurance intervention and life-changing decisions for patients and the poor care that often resulted. I was losing sleep every night. I worried about my patient. If I just had more time, I could have given them better care. So 10 years ago, I decided to leave the traditional group practice and establish a cash-only fee-for-service practice. It was a practice just like that of my grandfather's before the invasion of Medicare. And it was a good decision. My overhead is reduced, the middleman is mostly removed, and I have attracted patients that care a lot about their health and are looking for a similar-minded physician. I spend an hour and a half with a new patient and 45 minutes with a return patient. As a result, the patient gets better care, and some of my patients actually drive 2 hours to come see me. I have made diagnoses in patients of mine that other physicians have missed. One example is a sick patient who was worked up in the ER over a weekend. He was sent home, followed up with his cardiologist on Monday, sent home again without a diagnosis. I saw him 2 days later and discovered he had endocarditis, an infection of his heart valve. This diagnosis requires hospitalization with immediate IV